Hello, my name is Patricia. I'm a childbirth educator at St. Clair Hospital, and I will be speaking to you today about breastfeeding. Breast milk is best milk for your baby. Human milk is perfect for human babies. It is species specific. Babies don't only grow, they thrive on their mother's milk. Human milk is designed for optimal physical, mental, and emotional growth and development. It is recommended that babies are breastfed exclusively with no other food or drink for the first 6 months of life. That means 100% breast milk. When you realize how breastfeeding has such a dramatic impact on the health of both mom and baby, any breastfeeding is worthwhile. After 6 months, other foods may be added, but still, breast milk is designed to be 75% of baby's nutrition from 6 to 12 months of age. Breastfeeding is important both nutritionally and for increasing health benefits. The experts advise women to breastfeed for at least 2 years. Statistically, in the United States, only 15% of babies are breastfed through their first birthday. We are far behind most industrialized countries. Why is this? Perhaps women are not educated about the differences between formula and breast milk. Choices may be based on incorrect or incomplete information. You need to know the differences between human milk and formula. Choosing what to feed your baby is an important decision, requiring careful consideration because of lifelong implications. Formula is made from cow milk protein and cow milk sugar, which is the perfect food to grow calves. It is very different from human milk protein and human milk sugar in digestibility and optimal nutrition. Formula is adequate feeding, while breastfeeding is optimal feeding. Formula is simply not as good as breast milk. It does provide nutrition, but its digestibility is nowhere near the digestibility of breast milk. Children who are breastfed have a decreased risk of digestive disorders such as celiac and Crohn's diseases and colitis. Formula does not contain live cells, while breast milk does. This includes antibodies and hormones specific to a baby's environment and needs. Cow's milk is a common food allergy for individuals of all ages. Soy milk, the choice of formula when a cow's milk allergy is suspected, is also a frequent food allergy. Formula does not provide lifelong benefits. Breast milk does. Mothers who breastfeed have a decreased risk of all female cancers, thyroid cancer, osteoporosis, obesity, type 2 diabetes, high blood pressure, and high triglycerides. The longer mothers breastfeed, the greater the decrease in risk. It is dose-related. Mothers also have a decreased risk of postpartum depression, and they actually get better sleep from the breastfeeding hormones while they are providing their own milk for their baby. Babies get an amazing amount of different health benefits, including physical, mental, and emotional ones, and more are being identified all of the time. Breastfeeding builds emotional bonding between mother and baby. Breastfed babies have less incidence of SIDS, or sudden infant death syndrome. As infants, they have an immediately stronger immune system, including a stronger positive response to the vaccines they are given to prevent a host of potentially fatal diseases. They have less risk of asthma, ear infections, flu, and even the common cold. Baby girls have a decreased risk of breast cancer in their own lifetime. All breastfed babies have a decreased risk of obesity, type 1 and type 2 diabetes, hypertension, and cardiovascular disease as they mature through their lifespans. So why don't more women begin and continue breastfeeding? Sure, breastfeeding is a commitment and may be difficult at first, just like any new endeavor. There are prenatal classes, books, and websites geared specifically for breastfeeding help. There are physicians and lactation consultants dedicated to assisting families with breastfeeding. Most mothers find that breastfeeding gets easier after the first 3 weeks and continues to do so. Breastfeeding provides amazing mommy milk. So why not breastfeed?